if you look at like rotator cuff, for instance, and let's just use supraspinatus as an example. You know, you have the supraspinatus, and most people, if Brianna was to come in and say, it hurts right here on the insertion of the supraspinatus, you know, most people would say, okay, let's just treat that area. But if you think of it as a traction pull on the tendon insertion, we need to actually look at that whole muscle. So the first component you want to look at is the supraspinatus muscle belly. So you want to go into that suprascapular area here, and you want to get in there with the Shockwave itself. And you can actually, before you do the Shockwave, just palpate the area, feel for stiffened, tight tissue in the area itself, and kind of just free up that muscle belly. So in terms of with the machine itself, just going to put that up to 5 bars. And so a lot of the times what I'll do is we'll just come in on the actual muscle belly itself. Now, one of the other interesting parts we have is some of the therapists now are using less and less gels and topicals to conduct the current. They want to actually increase the friction in the area. So we have some therapists that aren't even using any gel at all on the tissues, but we will. Just the gel. You're too tight.
Dr. Broadhurst and I we would debate that with Chris because of the propagation of the Shockwave itself. You need that coupling gel. But,
we'll prove it.
Yeah.
So if you can, so one of the first things you want to do is just come in on the actual muscle belly itself.
You can do it right there. You can hear. So imagine that thing's going. Okay. Go on.
Is that how you do your surgery? So you just come right in on the muscle belly itself, okay? Again, pressure is to patient tolerance. Like if you see their shoulder coming up to their ear, you're obviously pushing too hard. So you want to use this just as an extension again of your hand, all right? And so you're just working back and forth within the area, just trying to loosen up the muscle tissue in the muscle belly of the supraspinatus, okay? And so when you look at the first one, if we found a knot or a trigger point in there, so if I hit a spot right here, and Brianna says, okay, I feel that radiating down my shoulder a little bit, we know we're on our trigger point. So what we can do is we can just stay within that one area for 500 to 1,000 shocks, okay, just to free up that one area. And then after that, just sort of search out for any other sort of tight spots within the supraspinatus itself and free that up.
Question about pressure.
Yeah.
Can you dampen the excursion of the actual applicator if you press too hard? Does that reduce the sort of
No. The biggest problem is some people get in so hard and with so much pressure at the start, the muscle tightens.
See,
and
I
it
tend
protects.
to try to go as light as possible sometimes. Right? I'm just touching the surface of the skin, and I find that some people that can be more effective on some people. But it depends. You're right. Like it can dig in there or just back off.
But to your point, the other part that comes with it, sometimes if you're too light with your pressure, it hurts more because you have more skin sensitivity.
Yeah, you have to have a little bit of pressure.
So you want to have a little. So if you go too light, it can actually feel more uncomfortable. If you try it on yourself, it'll be more uncomfortable.
I totally agree.
And then, so clear up the trigger point, clear up the muscle tightness within the muscle belly of the supraspinatus. And then if we took Brianna's hand and we just tucked it behind, okay, we could have her point right to that spot of insertional tenderness. And right on that insertional tenderness, now we can get in there. And we can actually work on the insertional tenderness right on that spot. Okay? So it becomes threefold. So I think before, what we used to look at in 2006 is it hurts here, we're just going to shockwave right here. And I think over the years what we've been able to do is take a look at it more on a global approach for that area and free it up. Did you want to add anything to that one, or are you okay?
No, I think that's good. You just have to remember when Dr. Broadhurst did his double-blind studies, you have to take variability out of it to get published and approved by the FDA. So you have, when we had the plantar fascia, it was always on that spot. and you had the elbow was always on that spot, and the knee was 84%. When you start using the techniques that Chris and Dr. Gleitz have shown, you can even have better results.
Yeah, so we're hoping to take that, what was it, 75% success rates on some of those areas, and increase those success rates to be, 85 to 90% or 95%. And then, so that's the first one. So getting to the Achilles tendon, just being a little more specific, the client comes in and they point to tenderness on the Achilles tendon itself. So we think Achilles tendonitis, okay, or tendinopathy. And what we have to appreciate is we have to appreciate the full complex. So the full complex here would be, we want to come right up into the gastrocs, both the lateral head, the medial head, and we want to look at the soleus deep down below. And we want to sort of seek out any trigger points that would be in that area. And again, trigger points, we're looking for an area where you can put direct pressure down, and it can be hard pressure, especially with the soleus because it's deep within. So you really press down into the tissues, and if it creates a little bit of a referral pain, then we know that's a trigger point. So what we want to be able to do is we want to be able to get in on that spot with our phantom shockwave. And again, pressure, you can really get down in, right, Cheryl? Tap out. I hear you. Cheryl has got the coolest last name. You want to tell them what your last name is?
Broadhurst.
That's not very cool. So the right in through here, that's a tender area. So you can shockwave it and loosen it. Now just envision on this calf, if you take the tension off up here, this has a lot more elastic component than the Achilles tendon. So by taking the tension off up here first, before you go down and treat, again, you're gaining a lot of, you're decreasing sensitivity on that, potentially where that focal point is. And then the next component, once we get rid of the muscle belly, the trigger point, then we can come in right where the calf and the Achilles tendon come together. And what we can do is we can really free that up. Now, you can do it by keeping stationary in the area, but we actually use is a lot more of a sweeping motion, and specifically right where the Achilles and the muscle belly comes, so the musculotendinous junction. And we just kind of clear that whole area out. 1,000 to 2,000 shocks.
Excuse me.
Yes.
The pressure during the sweeping motion, is that the same indication as when you're searching for the tightness in the shoulder?
Yeah, it's good point. You want to try to go as deep as you can to patient tolerance, but again, respecting the fact that, that 3 out of 10 to the client, like, you don't want to go over a 3 out of 10. So let me know if you go higher than a 3 out of 10, let's scale it back a little bit. Either the pressure, and then if it's still sensitive, then you just got to turn your energy down. Okay.
And then the other adjunct to that, which Chris will be getting shortly within the week, is this V-Actor head. And again, it works very, very well. This one we can turn on, and it's a combination of shockwave and vibration. And after Chris has used that handpiece, you can use this one and do it the same way. How does that feel, by the way? So it really has your patient, what Chris emphasized, leaving with a very, very good feeling, and helps them with the muscles, with the lymphedema, any of that sort of stuff. This is a very, very good adjunct for that.
So that would be the next one for me, which is the smoothing at the end. So the smoothing at the end, we were using it with the shockwave, the radial shockwave. This one too, they're finding a lot of lymphatic drainage and everything. So you do your shockwave and then you create that drainage at the end.
That's a combination of shockwave vibration.
Yeah, so it's a combination. And again, just in regards to the smoothing. And then if I can have you just lying on this side right here.
Which one?
Yeah, facing me. And these are the ones.
What dose are you using, Chris, when you're treating Achilles tendonitis?
I'm sorry, what was
What
that?
dose are you using? What bars, what hertz are you using?
Yeah, so it's patient toleration, but the biggest thing, most of the time what we'll start with is at about a level of 2. If they tolerate it well, we'll move up. If they don't tolerate it, we'll back down. As you can see with Charlton there, when I was pushing just on that trigger point, just the pressure alone was giving him sensitivity. So that would be a good indication for me to start at a lower energy and build my way up. And what you'll find is as the tissues become tolerant to the energy going in, you'll be able to lift up your energy in bars. Most of the time frequency for me is 11 for most of my treatments, and then 15 for the smoothing part. I like to use 15 hertz as smoothing. But, you know, I saw in the studies, they're using 8 hertz and whatnot. Most of mine are 11 and 15, and some of our therapists use 13.
And this is preset, so you don't have to do anything with this now with the new generation. It's preset for the frequency and the energy level, so you don't have to worry about it. It's all preset. And built. And the vibration handpiece.
And so the last one, just talking in regards to some of these fascial pathways, you know, if we think of that whole lateral fascial pathway coming on down the lateral side of the leg, most of the clinicians know the Ober's test, where you sort of bring the hip back into extension, let it drop down. And what you find with a lot, especially runners, they'll be really stiff along that whole lateral pathway. And a lot of times what I'll find is with that stiffness is a weakness in the glute medius, okay? And so what we want to do is we would test it out, positive Ober's test on this side. Are you relaxed with that? That's okay. Right on your stomach here for me if you can. So the first thing we would do is the herniated trigger point. And in fascial distortion model, one of the most common areas is what we call the bullseye, right deep into the buttock. And so you hit the bullseye, and that's where we would use the Shockwave right away. Turn it up to 8 for me here. You'll find the tender point, and you'll release that trigger point right away. And sometimes just releasing that herniated trigger point, it'll cause a lot of referral pain into different areas. The second part, though, is when we take Charlton back into the sideline position, sometimes that tight IT band it'll drop right down. So the Ober's test will now become sort of within normal limits. If not, then the next step is looking at the primary trigger band. So our primary trigger band down the lateral side, you can find the most tight band along, and then you'd use the sweeping motion, again for anywhere from 1,000, but realistically 2,000, and if it takes more than 2,000 to loosen it up, again you're using it in a much broader area. So you just start using the Shockwave to loosen up that whole lateral band. Sometimes you free it up right through here, and they'll say I feel tightness now into my shin. So you can even come down and just work it through on the perineal side. Okay? And then same concept with the Viactor. Viactor, you can loosen it through, just improving it at the end. And it's really, you know, the combination of the treatment on these ones here. These are the ones that are going to come into your clinic sort of on a 4 to 6 week basis when they're training and say, you know, I've been doing a lot of heavy training. I need to get my IT bands freed up. I mean, it's a regenerative type of programming that you're going to be using, and I think you'll see a lot more of this for the sports medicine clinics. That you'll have a lot more therapists coming in, or sorry, patients coming in, athletes just saying, I just need to get freed up. You know, the foam roller isn't doing it, my stretching isn't doing it. I need to get some assistance with this, and it's a great revenue generator.